Hey tribe, so glad you're here with us this afternoon. Brittany has joined us. She is a nurse practitioner in the surgical ICU, and I am so excited that you're here with us today, Brittany.
Thank you. Thanks for having me. I'm excited to do this.
Yeah, so we had so much interest and so many questions come through before we even went live. So if you have questions, get them in, but we are going to go through all of the questions and get them answered. I know you have a passion for ICU nursing, but nurse practitioner, and as well as being a registered yoga teacher. So I can't wait to hear how you weave that together. But would you just take some time and introduce yourself?
Yes. All right. So I'm Brittany Steckel. I'm a nurse practitioner in a surgical ICU. I work at a huge hospital system, so we do everything from transplant to ECMO to trauma, big open belly surgeries. So it's a very wide variety of things. Before that, I was a ICU nurse in mostly surgical ICU, and then an ER nurse before that. And I did one contingent year of peds neuroendocrine kind of floor just to kind of round out my trauma experience. So yeah, that's about it. I live in Detroit. I have a golden doodle named Lucy. I love to run. That's kind of my other passion, and reading. So just trying to be outside as much as possible for the 4 months a year that it's warm here.
That's awesome. So I like to do a kind of icebreaker where you tell us your funniest nursing story.
All right, I have it ready because I saw that one in advance, and this is one of my absolute favorites. Now, I didn't mention that I also love teaching. So I loved having nursing students, and now I love having NP students. I used to teach clinical, and I did a graduate, in grad school, did a graduate certificate in nurse education. So I was teaching clinical one time, and it was a very introductory, doing your physical assessments, maybe learning how to do baths. And I remember saying in the class about writing the care plans to make your measurements or make your findings measurable. So if you're going to report on their pain score, I want a number. If you are going to talk about a incision, you want to measure it. And I will never forget that I had a nursing student measure in inches a bowel movement on her care plan. And I was both proud and horrified at the same time. I was like, wow, you really pay close attention, but also you never need to report the inches of a bowel movement ever again.
That is awesome.
Yeah, I would have done that one.
So that's great. For any students listening, note to self.
Small, medium, large, loose, sure.
That's awesome. All right. So when did you decide that you wanted to be a nurse practitioner?
So let's see. I know for a fact that I didn't know I wanted to be a nurse practitioner in undergrad, or I don't even think I knew what an NP was like in high school. So it was after I had become a nurse. I think I was working night shift in a hospital right across from my window here. Very rough, low resources, inner city hospital, night shift, neuro trauma. These are essentially dead weight patients, and there's no nurse assistants. And it was just it was so hard on my physical body. I remember just being achy and in pain. And I was like, I'm only 24. Why is this, this is so hard on me. So I remember thinking, I'm so burnt out. And the only thing I knew at that time to do if you're burnt out is to go to school and do something different. So I'm not going to lie, that's kind of what got me into it. But I definitely have some tips and tricks and things that I know now about how to treat burnout that are not necessarily just going back to school. If you know you want to go back to school, or you want to be a nurse practitioner, that's one thing. But just going back to school because you're burnt out is a very costly, stressful decision. So maybe work through the burnout first. And if you're interested in it, going to NP school from a place of wanting more knowledge and not as an escape from burnout, because that's kind of how I ended up doing it. But now that I am here, I love it. But it was from a place of burnout that I ended up going back to school. But
That's great advice and really great insight too. I'm all on board with that. So where did you go to nurse practitioner school?
So I went to Madonna University, which is a very small Catholic university in Southeast Michigan. And I don't know if any of you guys remember, but like in the 2010, 11, 12 period, there was a lot of talk that nurse practitioners were going to have a doctorate degree. The American Physician Association had decided that needed to be like baseline. So there was all this talk, oh, by 2015, all NPs are going to have a DNP. So the university that I literally live on their campus got rid of their master's degree acute care program. Okay. So that's kind of how I started looking elsewhere. And I found this like small Catholic school that was really known for its nursing program. And I'm not Catholic or religious in any way, but I really loved their kind of holistic, humanistic approach to nursing. So I ended up like loving it so much. So really small school for NP.
Okay, good. And so did you feel like, we'll back up a little bit because I feel like this is a good question that someone asked. If you feel like the ICU is a good place for a new grad to start in the very beginning.
Yeah, I was kind of looking through this just before. So I have a couple of things. For the right people, maybe you were an ICU tech, or maybe you weren't and you are just like really into studying and you feel ready. For some people, I think it's a great decision. If you can get a good preceptor, maybe a preceptorship, like a nurse residency type of thing, where there's like didactic education and maybe a consistent preceptor over the course of like even a year. If you can find something like that where they're going to safely lead you into practice, I think it's a completely perfect way to start. I mean, I went right into the ER as a new grad and it was fine because I had a really good preceptor. So if it's a good environment, it can be great. I think it could also be a horrible experience if you aren't set up for success per the structure of the education system in that ICU.
Yeah, I agree. I started in ICU myself, and we all have our perspective is very shaped by our experiences. And so you're going to get nurses that say, yes, it's a wonderful idea. And you're going to get nurses that say, no, it's an awful idea. Yeah. And so I really think that you have to kind of maybe do a shadowing experience.
Yeah.
Try to get some sort of perspective for yourself before you just dive in. From your perspective personally, do you feel like seasoned nurses struggle to precept new grads more or less than those experienced nurses? Because that goes both ways too. What's your experience?
I would say there are pros and cons to both sides, obviously. My first thought is people who've never been a nurse before, if you're training them, they don't have bad habits from somewhere else. And I don't mean bad habits, I mean floor habits, or I mean ER habits. And I know that as having been an ER nurse myself and transitioning into the ICU, I remember being like, whoa, this is a whole new world. So in some sense, I think it might be easier to train a new nurse because everything you tell them, they know and believe as truth. And you can kind of like mold them into an ICU nurse as opposed to like reshaping them from maybe floor ER or something. So there's that. But I guess with experienced nurses, as long as they're teachable and not, I know what I'm doing, I don't need, as long as there's a good attitude on both sides, I think that could probably be easy. One thing I would say is if you can find a step down floor that has the same manager as the ICU, that's how it is at my hospital just recently. And that is a really good situation because your manager can see how you do in step down and then maybe either approach you or maybe be in conversations from the beginning when you start in step down to be like, hey, I'd like to go to the ICU eventually. Like, can you help me? And then again, doing like shadowing and stuff like that. Because you might have a better experience when a manager knows you, helping you set up with a really helpful, loving, guiding nurse to train you that's not going to like humiliate you or, be frustrated through that process.
Yeah, I agree with that. And also maybe volunteering to be part of the float staff that goes to that ICU, knowing that you're obviously a step down nurse, you don't have ICU experience, but yet you can float there and take that borderline step down patient. Totally. I think that's also a nice opportunity to get your foot in the door. So this next one is back to your nurse practitioning schooling. Did you have to declare your critical care track when you were headed in? Okay.
So yes and no. So the way that it's set up is, and this is countrywide, but there are some things that vary state to state. So there is acute care adults, there's primary care adults, there's family nurse practitioner, and then there are like the peds specialties. And then within there, you can work in like some subspecialties like palliative care, hospice, and then maybe like NICU, PICU type stuff. So the one that I did was acute care nurse practitioner. And this, I think, is countrywide, that all acute care nurse practitioners, as of, I think, 2013-14, because of the aging population, are kind of like double boarded in geriatrics. Okay. So I actually have acute care, geriatrics, nurse practitioner, essentially. And the primary care is like that also. So I guess in one sense, you need to pick either family nurse practitioner, which we can talk a little bit more about that in a second, or primary or acute. So, but acute care refers to anything that's in the hospital or is like a sudden onset or episodic care. And then primary care is doctor's offices, cardiology offices, things that are more managing long-term chronic illness. So I guess since you need to like pick, like, do I want to work in the hospital or do I want to work in the community in the offices? So in that sense, you kind of got to pick at the beginning, but I didn't have to say like, I want to work in critical care. You know, I just said, I want to work in acute care in the hospital. So
are any of these specialties, so you choose acute care, can you then work primary care? Is there some flexibility to your practice?
So that's actually a state-to-state question. So in Michigan, at least, right now, family nurse practitioners can work in the hospital. Okay. Ohio, I don't think they can. So it kind of depends where you live. But I would say if you are thinking about working in the hospital, especially in critical care, I don't recommend doing family. Because yes, there's family nurse practitioners on my team, but at least one or two of them have gone back to get double boarded in acute care because it seems like that's coming down the pipe because you're kind of practicing outside of your what you're trained in. I am in no way prepared to work in a doctor's office at all. So I would not feel comfortable going to work in a doctor's office without getting double boarded, which is like a year and a half. Like it's much shorter. You can do that, but you have to take boards and everything. So if you know you want to work in the ICU, I would get an acute care certification.
Okay, that's great advice. So some students are, how do I say this? Kind of pressured straight out of nursing school to continue on to nurse practitioner school. And some schools actually permit that transition straight from your BSN program right into your nurse practitioner program. I was in the midwifery program. I got in straight out of nursing school. And then I was talking to my aunt who's a nurse practitioner, and she was like, you really should back up the bus. I really don't know that that's a great choice for you. Like, what if you hate midwifery? Why would you choose that? You have no background in midwifery. And I got to thinking and withdrew from the program. But what is your experience like? Do you recommend people go straight out of school? What is your recommendation? Uh-oh, I can't hear you. There you are.
Sorry. Sorry. I think I moved something. I do not recommend going to NP school right out of school. I don't. Now, there's a couple of caveats to that. I did a 4-year part-time program. So yes, in theory, maybe you could be a nurse for 4 years during the program and then have some nursing experience when you're done. Okay. I ended up being a nurse for just over 6 years, and that seemed like a bare minimum to be ready. I would definitely, if you're thinking of being an ICU nurse practitioner, have been an ICU nurse for a long time. Mm-hmm. I can tell you, I work on a team with a couple PAs also who have never been ICU nurses, and the transition, just being an ICU nurse gets you so many steps ahead in becoming an ICU nurse practitioner because you I work so closely with the nurses, and I need to know about pumps and NG tube, placing NG tubes. There's so many skills that you need to have in case your nurse can't do them. And there's a lot of things about just like the day-to-day management of patients that would be, I don't know, you would have such an uphill journey to catch up, and you're already stressed when you first become an NP. You're like, you need to be able to focus on like meds and more detailed assessments and all of the organization and communication from the different services and everything. So I would not want to become an NP having not been a nurse for a while, just because that learning curve would be so steep.
Okay, that's great input. So when you get out of nurse practitioner school, you've already had your training, you've been on the floor as a nurse for, in your case, over 6 years, and now you're a nurse practitioner. What does that training look like for you going forward?
That is going to vary wildly. I can tell you what my experience was like, and it honestly was not a great transition. I survived, and it's fine now, but there's so much room for improvement. I got hired at the same time as 7 new nurse practitioners to start a new service. So there were like a couple people who had been there for 3 months or 6 months, but there wasn't enough for them to actually train us. So pretty much the way it went for me was like, here's how to use Epic. Here's the code for the door. Like, these are the surgeons to watch out for. Good luck. Which was really, really traumatic for the 7 of us for that first year or even 2. Mm-hmm. I've been there for almost 4 years now, and it's really great experience. But it would have been very nice for there to be someone who had been doing the role for a while to kind of help lead us. And teach us and kind of hold our hand, because it's not like having a preceptorship or being oriented as a new nurse. You jump in. Is
it ever like that? Because when I was in the pediatric ICU, when we would have nurse practitioners or physicians hire on, they did kind of get, I wouldn't say a preceptorship, but they had like a guided orientation of sorts. Yeah. Different than that new nurse role, but still somebody to answer questions and this is how we do it here kind of thing.
Yeah, I would ask about that in detail when you do an interview for a new role. It wasn't an ideal situation. There was like a new role. So
super different when you're one of the initial 7 starting this program.
Yeah. Especially because we work so closely with surgeons, and the medical model is like for surgery, like we were pretty much trained by surgery residents. So if you think about how they learn, it's humiliate them until they don't forget. It's a very like cutthroat, eat your young, like put trial by fire type of learning environment, not like nursing model where we at least try to kind of usher people in like a step-by-step and more safe. So just ask a lot of questions about what your orientation process will be like, I guess.
Okay, good advice. So are there specific certifications for your specific track of surgical ICU nurse practitioning that your other colleagues don't have?
There were a few. I don't know that they're necessarily required. Like, you don't have to have them before you start, except for ACLS. You definitely have to have ACLS before you start. But I had TNCC from when I was a nurse. I haven't renewed that. But one of the programs that we all went through was the Fundamentals of Critical Care, which is, I think, a Society of Critical Care Medicine program. That was really, really helpful. We did like a 3-day course at one of the hospitals. Sorry. It's really dusty up here. At one of the hospitals near us, we went for like a 3-day course, and that was really helpful. It was like more specifically about like event management and, escalating and de-escalating pressors and some of the things that as a nurse, like how to do, but you don't know why. So that was very helpful.
Okay, that's good. And what does a typical day look like from the time you get to your unit until the time that you leave?
So our service is 12 day shift nurse practitioners, and I think we have 6 night shift nurse practitioners. So day shift is 5 a.m. to 5 p.m., which sucks so bad, but it's fine. It's just really early. I usually get up at 4 or 3:45 if I need to like get some things ready. So I go to bed super early, 3 nights a week. I get there. We have about a 20-minute, like kind of hectic sign out process right when we get there from the night shift. We blind assign these like blocks of rooms. So it's not really like, okay, here's 2 really critical patients and then 3 step downs or whatever. It's just kind of like by blocks of rooms. And then if you end up having like a bunch of really, really critical patients, your coworkers kind of help, balance things out a little bit. So we'll get our assignment the day before, get signed out from night shift. And then usually from like 5 a.m. till 8 a.m., it is what my friend calls a drag race. Cause it is like you are just scanning through charts really, really quickly, doing, starting your notes. It's so like being able to read and comprehend things very quickly would be a very helpful skill in the ICU, especially because you're reading all the notes from yesterday, all imaging, labs. There's just a lot of data collection because we start rounding usually at 8. We have our intensivist is on for a week straight. So sometimes if you're working like later in their week, maybe they might know the patient a little bit better. But if you say start on a Monday when they do, like you're pretty much the person that's going to be presenting this stack of critical patients to them. So it's just a lot of things to kind of get straight. So checking labs, replacing electrolytes as needed, making sure all their medications are ordered appropriately, and then writing your note for the day. So I'll pretty much make a skeleton note and then kind of throw stuff in there as I come across it. And then get ready to round. I usually like print my paper note after a little while, write my labs out, write my checklist. I have a daily checklist that I live and die by. And then round. When I was the first year or two, probably first 2 years, I loved rounding on the whole unit because it like helped me to see how other people present, what different surgeons find important, those kinds of things. Now, sometimes I feel like I work on my 6 patients until the very last minute and then just kind of, present on my block of rooms. So then you kind of go through, tell the surgeon, name, what they're in for, their major surgeries, major procedures, complications, highlight the last events over the 24 hours, and then head to toe assessment and integration of like the plan of care. Mm-hmm. And then we do multidisciplinary rounds. So we have everyone there, RT, sometimes PT, the nurses, charge nurses there, 1 million residents, pharmacists. It's like a huge group of people. So then present on rounds, and then you put in a bunch of new orders so that you've come up with these new plans throughout rounds. Make a lot of phone calls, tons of phone calls, read consultant notes, call and update family members, maybe do a more thorough physical assessment. Sometimes in the morning, you're kind of just like, peek, quick, neuro, cardiac, look at their toes, and then kind of move on. So, and maybe in the afternoon, usually go a little bit more in depth, look at their wounds. Maybe sometimes we like document pictures of different wounds and things they have. And then in the afternoon, maybe get an admission, maybe send somebody out, kind of wrap things up, make sure all your labs and x-rays are ordered for the next day. And then we do like a little written sign out for the night shift, just because we can print it out and have it more easily. And then we'll give them a quick sign out before we go. And then I go home. It's usually a very wild day most of the time.
So 3 shifts, 5 to 5, right?
Yep.
Okay. So how do you feel like your work-life balance as a nurse practitioner compares to your time as a nurse, since you're working 312s and you worked 312s as a nurse? How does that compare?
So when I was a staff nurse, I worked a ton of overtime. I was in school. I always had a continuing job because I was trying not to get into much debt. So I was like working like a crazy person until I graduated NP school. So I actually feel like I have a lot more life balance now that I'm NP, just because I'm not in school, and I mean I don't have kids, so it's like I have a little bit less responsibility on my days off. We have full night coverage, so we don't have any on-call days. I work from when I get there. I'll usually leave my pager on, and the nurses can text me like, for a couple hours after I leave in case they have a specific question. But on my days off, I'm not contacted or paged or anything like that. That's not true for all roles, but for mine it is. So I love the work-life balance of being an NP now.
That's great. So do you miss anything specific about bedside nursing?
Yes.
What do you think?
Definitely. I feel like when I was a nurse, especially when I was a young nurse, I would say like at least 3 to 5 years of your first 3 to 5 years of being a bedside nurse, you are so focused on the tasks and the meds and like the mechanics of being a nurse that you almost like don't have it like, real quick, like muscle memory. Whereas like after you've been like a staff nurse for maybe like 6-10 years, a lot of that stuff is just your body will just do it automatically, and you can use your brain and your presence and your like more like emotional connection with your patients and maybe digging into like building a better relationship with them. So I definitely feel like I wasn't a nurse long enough to like get to that spot where I could like really just like sit and chat with a cute old lady, for a couple minutes every day. So I do kind of miss that because honestly, most days I'm a little too busy to like sit and hang out with patients. Every once in a while I will. And I do kind of occasionally miss being able to talk to patients because I'd probably say 80% of my patients are intubated or sedated in some way. But it's a lot of like talking with families. So some of that like really true bedside caring moments I don't always have time for anymore, which I do kind of miss that a lot.
Yeah, I bet. So what would you say the top 3 challenges nurse practitioning presents?
Yeah, I actually wrote these down. Let me see. Oh yeah. So learning what's important to the intensivist or your surgeon or whoever the physician that you're working with.
Sure.
It takes a long time to figure out what they need to know really quickly.
Mm-hmm.
If you work with a resident, they'll sometimes help you like work on one-liners or like how to summarize someone who's been here for 90 days in like 15 seconds is like a crazy skill you don't learn in school. Yeah. So definitely priorities and finding out like exactly what to look for in the chart right away. Because I know when I was new, I would just be like so lost by how many notes to read and stuff like that. So prioritizing things and then eventually learning to trust yourself. Because for a long time, I was just like anything someone else told me, I assumed they were right because they've at least worked here longer than I have. So, and then eventually being like, oh no, I do know. Okay, you make the right decision enough times that you start to learn to trust yourself. And then the third one I would say is being organized. Being an ICU nurse practitioner or any ICU, I think any unit-based nurse practitioner or mid-level, like you are literally the like middle of the circle of a million consultants and a million different opinions, and everyone calls you, and you need to be able to like synthesize all of those people's opinions and out in their views, and then like come up with the best plan, present it to the intensivist, get their decision or opinion, and then like execute it. So it's a lot of moving pieces, I would say. And being able to talk to families is really important because I have a lot of very difficult conversations with family members, I would say.
Sure. Yeah, for sure. Do you feel like this is a high stress work environment? And if so, do you have any sort of support offered to you?
Yes, this is a surgical ICU at least, and I'm sure other ICUs. It is very high stress because stuff happens so quickly. Like your patient who you think is fine will code, and it's just like a lot of unforeseen circumstances. And it's a lot of end of life care. So that's really stressful. And then, surgeons aren't known for being the most patient people. So there's just a lot, there's a lot of stress. I would say for me, what's always been the thing that's helped me deal because I have lifelong anxiety. And the way that I've dealt with that was always like running or exercise and kind of like getting the jitters out, and then yoga. Yoga's been a big part of my story, and I think there's a lot of really helpful tips and tricks that yoga has that answer so many of like nurse anxiety and nursing challenges about learning how to control your nervous system, most importantly. So I would say some learning how to kind of hack your nervous system by some breathing techniques, and yoga has been a really helpful way that I have found to kind of deal with that stressful environment. And then in terms of things that I was offered, like I think the biggest thing is having a good team. So I have like our team of NPs is like super tight, so helpful. There's always a group text message going, and you don't feel like you get left behind now. But that took us years to build up to that. So those are kind of two: teamwork and self-care, I guess.
Yeah, absolutely. Yes, for sure. And I want to hear more about your yoga practice as we get towards, we'll cover a few more of these questions, and I'd love you to dive into that a little bit more.
Yeah, love it.
So what characteristics do you feel like makes a nurse practitioner successful? Maybe broadly, and then maybe in the ICU setting overall?
Being organized would be my first one. And being able to show up for the shift well cared for yourself. Because I think if you're stressed out at home and then you show up, you're not going to be the best asset to this stressful environment. So I would say having your shit under control in your outside life is a really, really good start. And then being organized, being able to retain a lot of information and like reading quickly, and it's just like a flood of stuff coming at you, and you need to just be able to like pick the very specific things that matter and like be able to get this like zero in focus on the stuff that is important, especially in the ICU, because like if you work in the ICU, like alarm fatigue, like imagine that times a million, because now you have a pager and the nurses can text you, and you have like, it's just like so many consultants all the time. So being able to like stay calm in dramatic situations, or when a lot of people need things from you, I would say. And then working from checklists, I teach all my NPs a very specific checklist system. And then during rounds, as I'm presenting and talking and other people are mentioning their opinions, every single thing that comes up that I need to do, I write it next to that body system, and I make a little square, because then after rounds, I need to go back and I need to like check off that I've done all of those things, made those phone calls, changed those orders. So being organized, I would say, is probably the biggest one.
Yeah, for sure. Do you have, that sounds like your favorite tip too, as far as your role is being organized and having this list. Am I right?
Yeah, that's why we're there, because if you like, especially in surgery, the surgeons need to be able to go back to the OR, and they need someone there to like help, make sure things are running smoothly. So
yeah. A viewer asked if you would mind sharing your checklist. Would you mind sharing that with the
Absolutely. I mean, I can tell you, or maybe I'll post it below, but if for my unit specifically, give me a second. I have to close my eyes. Notes, assessment, labs, x-rays, electrolytes, the primary service, checking in with the primary team, and then their plan. So that's a P. It's 2 for 2, two things for P. Do rounds, check their electrolytes, make sure they've had a bowel movement, clean up orders, because the nurses love that, because I don't know about you guys, but like no one else except for NPs ever goes through and gets rid of old orders that don't need to be there anymore. So then there's like a million. So clean up the orders, and then fill out my sticky note, which is like our night sign out thing, and then DVT prophylaxis, which gets skipped a lot in trauma and surgical patients because they can't have it for the first few days, and then people forget to kind of get it started. So that's mine. If you need to like DM me to send you that, let me know, and I can.
Or we can also upload it to the group as a file, and that way it's accessible if you're comfortable with that.
Cool. Absolutely.
Sweet. Okay. Yeah. So what would you say is the hardest part of your job?
Strangely, the hardest part for me is also the most rewarding part, because that's just life, is dealing with end-of-life care. So if you are interested in end-of-life care, yeah, palliative care is a good route to go, but working in the ICU, you're actually usually the first person to deal with that. And a lot of times by the time I consult palliative care, the ball's rolling. I mean, I put in most of my own comfort care orders and like palliation, like cleaning, making it so it's just comfort care only and kind of getting rid of the medical interventions. But that can be very difficult. And especially just coming off 2 months of COVID, that was all we did essentially. I mean, the residents were in the rooms running codes, and I was on the phone in an N95 mask, having very lengthy end of life discussions on a conference call. So it's just like being able to deal with that takes a level of training, confidence, presence, nervous system control, belly breathing, not freaking out, and kind of learning the right words to say. That's definitely the most difficult. But like my husband always says, like when I come home from days where I did that, like, yeah, I'm sad, but I also am like, I actually helped someone have a beautiful natural death. Whereas a lot of ICU nurses know, like, we spend a lot of time providing what ends up being futile care. And there's no way for us to know that until it's been 3 months and someone, decides to ask the family, like, is this what this person would have wanted? And they're like, no. And they're like, oh my God, how has no one talked to you about this yet? So that's definitely more challenging, but also it's a place where our nursing background and our humanitarian efforts can have such a huge impact.
I agree. Allowing people to have that death with dignity is so hard, but it's yet so rewarding. I completely agree with you. I 100%. So make sure I'm not missing anything that we should have covered. I don't think so. You love to use yoga practice, and you actually do some classes virtually, right?
Yeah.
Do you do it in your hospital as well as online? How do you work that?
So when I actually did my yoga teacher training through my healthcare system, which is crazy. It is the only yoga therapy school that's hospital-based in North America, which they love to tell people about, the Beaumont School of Yoga Therapy. So that's such a cool model that we have an integrative medicine department that is developed enough to have their own yoga teacher training program, which is awesome. So I did it through there, which was cool because it was very science-based. It was yoga for every type of body. It was highly modifiable. It was based on helping, like, what yoga can do to help disease processes, very A&P. So I got to do all my training hours teaching hospital employees, which was so awesome. So that part I did at my hospital, which was really cool. I was supposed to teach for Nurses Week, but because of COVID, that got a little bit messed up. So our Nurses Week is going to be in July, apparently. So like little things like that, yes, but otherwise I've mostly been teaching out of my house. In the summers, I've taught in a park near our house, which is really fun. I love outdoor classes. And then more recently, because of COVID, I've developed a full 8-week program that is called Yoga Your Way Out of Nurse Burnout, which has been super powerful. I'm taking my first 10 nurses through that right now. We're on week 5. It's incredible. So that's a mixture of physical yoga practice, yoga philosophy, and using these yoga tips and tricks to answer like 8 of nursing's biggest challenges. So all of the challenges that I've come up with are, I have like 600 answers from nurses of what's your biggest challenge in nursing. And I boiled it down to 8 topics. So leaving work at work, emotional processing for difficult cases, getting along with coworkers, taking care of our physical body. There's 4 more, I guess. So that's been really, really fun. And that's available for anyone if they're interested in joining. And then I have some smaller like workshops and a little bit smaller offerings. But that 8-week course is really a deep dive into how we can deepen our yoga practice and our nursing practice and how they fit so well together. It's crazy.
So I really love that your hospital took that initiative and started that course. I mean, how influential is that? That's amazing that they did it science-based and really taught you guys the process in which you were really physically doing these poses and whatnot.
Yeah.
Anyway, so you guys, it sounds like that was mostly staff focused, right? Okay.
Yes, but they do have a lot of patient classes where
That's awesome.
the actual yoga therapists. So that's like 1,000 hours of training. I don't have that yet. The yoga therapists are the ones that provide patient care.
So
patient
are
yoga.
you permitted, since you've been through the course with your hospital, are you permitted to teach, not necessarily like full-on poses or anything, but teach maybe the basic concepts to your patients? Is that permissible?
Because most of my patients are intubated, that doesn't really work so much. But I will say, when I work step down occasionally, I've learned how to calm anyone down from a panic attack. So you can teach people diaphragmatic belly breathing, teach them kind of like square breath, which is a really interesting way to kind of lengthen the exhale and inhale, because a panic attack is hyperventilation and your CO2 level is plummeting. So kind of starting to stabilize the CO2 level can make people feel comfortable. So I've definitely like post-extubation or like trying to prevent an extubation or calming people down with pre-surgical anxiety. Absolutely. Throw in some like, breath work tricks. In that way, most of my patients are not physically able to do any type of physical yoga practice, but in our inpatient rehab, they do have yoga classes for patients, which is really cool.
That's really neat.
Yeah.
So we're getting toward the end of our discussion here. And since there's not more comments coming in, I would love for you, you had mentioned doing a deep breathing exercise with us as a group. If you want to do that, you're welcome to. It sounds like yoga is probably one of your favorite nursing hacks, aside from the things that you discussed previously. So why don't you tell us, I'm going to take myself off the screen so that you can kind of take over and I'm not distracting anybody. Just so you know, you won't be able to hear me. I'm still here. But so I'm going to give you the floor, and I would love for you to tell us what you're looking forward to most in your career, and then you can take the stage and do what you want, and I'll come back whenever you're done.
Awesome. Cool. I guess I would say what I'm looking forward to most in my career is helping nurses understand that their presence and their open heart and their empathy is why we need nurses. Helping people in their holding space for people who are in pain, who are hurting either physically, emotionally, mentally, is the role of nurses. And yes, we mostly work in hospitals where we're dealing with physical pain. But as we all know, there is a lot of emotional, mental concerns that are going on with our patients. So I guess empowering nurses to know that their practice of presence and showing up at the bedside as a loving, open-hearted person, nurse, human, is a very powerful way for them to contribute to society. So I love teaching nurses that and helping nurses discover that that is true for them. So I guess to get started, so all nurses know the spine moves in 6 directions. So we have our vertebrae that provides structure for our spine. We have the CSF, which is that flow. So all of yoga is about structure and flow. So how convenient. And then that really holds our nervous system, our spinal cord through the middle of it. So that's super crucial, is knowing how the spine works. So we can bend side to side. That's 2 of them, left and right. This lateral side bend is important. We can go forward and backwards, so opening the front body or kind of compressing the back of the vertebrae, or forward fold, coming forward and really kind of compressing the front body and stretching out the spine, and then we can twist, left to right. So all yoga practices should start with all 6 of those movements, and maybe if not specifically, they'll all be addressed in different practices throughout the class. So just a really simple way, if you're ever like 4 a.m. night shift, super tired, and you're trying to wake yourself up a little bit, just doing the 6 movements of the spine, either even at your desk, chair, or maybe in the break room or something, can really help you feel more alert, because it's literally just like helping pump that fresh CSF up and down your spine, around your nervous system, your spinal cord. So you're also going to want to link those movements with breath. That's where yoga comes in. So anytime you're inhaling or getting larger, you're going to be taking an inhale. You're going to be expanding your ribs. And then anytime you're contracting or coming down and really the ribs are starting to close in, you'll be exhaling. Makes sense? Inhaling when you're getting bigger, exhaling when you're getting smaller. So we can just do the 6 movements of the spine, and then I'll just lead you in a really short meditation that I end all my classes on. And you'll know that you can just make yourself calm down this way anytime you need it. So wherever you are, just whether you're sitting or standing, it doesn't matter. If you're sitting, maybe kind of move the flesh away from your hip bones a little bit. So those 2 sit bones are just on something sturdy and stable. From there, roll your shoulders up towards your ears and let your scapulas just kind of fall down the back of your ribs there. Imagine a string pulling out of the top of your head. So it's really stretching your spine in 2 directions here. Bring one hand to your heart, one hand to your belly. These diaphragmatic or deep belly breaths are important because they stimulate our parasympathetic nervous system, all of our belly organs, so rest and digest. So inhale in through your nose, out through your nose, having your belly moving, your belly button coming out on every inhale and then pulling back towards your spine on every exhale. That's going to help your diaphragm move up and down. Instead of breathing up here through our chest and expanding the rib cage through the top, we're going to be pulling the diaphragm down by contracting and inflating the belly. That will stimulate our vagal nerve, our parasympathetic nervous system, and instantly make us feel calmer. So a couple deep breaths through the belly. The best part of this is you can do this while you're walking to a code and no one will know. So you're just hacking your nervous system a little bit. So you arrive in that stressful situation already a little bit calmer with more clarity. Good. Start to inhale, sweep your arms up all the way overhead. Exhale, drop your hands down really slow, kind of like your arms are kind of going through water. There's some resistance there. Slowing down the inhales and exhales. Inhale, raise your arms up all the way overhead. Exhale, drag them down slowly. Inhale, arms up all the way overhead. This time, drop just your right arm down. Your left arm's going to stretch up towards the sky. Keep that left sit bone planted on the chair or whatever, or if you're standing, just stay just how you are. Hips are equal. And then on your next exhale, you're going to start to tip over to the right. Getting a nice juicy stretch in the left side body here. Make sure you can peek up and under your left elbow so you're not kind of hunched over. You really want to be open chest, gaze lifts. Big inhales, big exhales. And then on an inhale, because we're returning to the middle, we're getting our ribs larger, we're going to be inhaling back towards the center. Both arms up overhead. Exhale, drop just the left arm. Right arm reaches up overhead and then over to the left. Gaze up and under that right armpit. Make sure your right sit bone stays planted. And just breathe into those right ribs. Feeling that juicy stretch. Starting to mobilize the spine. And then inhale, back to center. Exhale, hands to your knees. We'll do some kind of, they're called cat-cow back. So you're going to be kind of like a curling the spine shape. I'll go sideways for this one. On an inhale, open the front of your body. Gaze lifts, throat opens. And then on an exhale, curl your spine, chin to chest. Inhale, open the front body, shoulders pull back, gaze lifts. Exhale, curl back down, chin to chest. A few more of those just to the pace of your own breath. Good. And then return back to a neutral spine. Inhale, both arms up all the way overhead. Exhale, twist to the right. So your left hand can come to your right knee, your right hand back behind you. Tall, straight spine. Every inhale, get taller and taller in the spine. Every exhale, twist just a little bit farther, maybe peek over the right shoulder. Check in with those deep belly breaths. When you're in this twist, it can be an interesting challenge. And then on an inhale, unravel, arms back up to the top. Exhale, twist over to the left, right hand, left knee, tall, straight spine on the inhale. Exhale, twist to the left. Gaze over left shoulder. And then on an inhale, return to center, arms up overhead, big deep inhale. And then exhale, hands to heart center. We'll end just with this modified loving kindness meditation at the end. I end all my classes here. This feels particularly important right now with everything that's going on in the world. But this is a way you can bless yourself, bless others, and send a blessing to all beings. You can repeat in your head, either quietly or out loud. May I be happy. May I be healthy. May I be whole. May you be happy. May you be healthy. May you be whole. May all beings, and in light of recent events, especially our Black brothers and sisters and social justice warriors, be happy, be healthy, be whole, and may I add safe. As nurses, we are blessed to be able to protect people in their times of struggle. Thank you for doing your part to help people feel better every day. The light and teacher in me sees and honors the light and teacher in you. Namaste. I hope that helps you feel a little bit calmer and more centered and more safe, and just kind of reignites your passion for taking care of people. You got to take care of yourself first so you can have a long career of giving back to the people around you.
Absolutely. I appreciate your time with us today. I really appreciate your love for nursing and your love for our self-care and preventing burnout, because we really have to attack it at the very beginning of our career, because it sneaks up on us so fast if we don't.
Absolutely.
So those of you that tuned in, thank you. Have a good day. And I really appreciate you guys. See ya.
See you later.